Blessings, ladies and gentlemen. Welcome to UNICAL 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment. 360, we love to call it a do infotainment. Like we said during the breakfast show, the morning bus show, that we have a very special, session with the Director General of the Primary Healthcare Development Agency, in the person of Dr. Vivian Mesembel too, and she's in the studio today. And we're going to talk about the Measles and Rubella campaign going on right now in the city of Calabar. I know that you heard the jingles all over radio. I mean, we've been blasting it over and over again, but the DJ is here to talk to us more about the Measles and Rubella campaign. A very good morning, Ma, and welcome to the show.
Good morning, UNICAL Radio. Good morning, Cross Riverian. Good morning, Nigeria.
Thank you for joining us again. This is like my second time of speaking to you, and I think at this point we are family now.
Yeah, sure.
Okay, so how do you feel today, Dr. Vivian?
Yeah, good. We're rounding up in the weekend, so today is good.
Okay.
What they call it?
TGIF. Thank God it's Friday.
Thank God it's Friday. Yeah. That's the mood.
Amazing. Thank you so much for joining us one more time. Okay, so Dr. Vivian, there are lots of people that are hearing about the Measles and Rubella campaign for the very first time. So people even hear the jingles on radio, but they don't quite understand what the context is all about. So from the perspective of a doctor, a medical practitioner, can you shed more light on it?
Yeah, measles rubella vaccine is a new combination that the federal government is rolling out. All along, we've been giving the measles vaccine.
Okay.
But recently, we've found out that our children come down with rubella virus. And so it was important for us to incorporate the rubella vaccine alongside with the measles vaccine. So the two, measles and rubella, are two viruses that are highly contagious, especially in children. And they cause a lot of clinical manifestations that are detrimental to the life of the baby. And they usually come down with fever, rash, malaria, conjunctivitis, catarrh, cough and catarrh. And then they can have complications like the rubella can have congenital rubella syndrome, where you find a pregnant woman when infected, the fetus come down with this congenital abnormality.
Okay.
Such fetus, when giving birth, at risk of blindness, deafness, congenital heart disease, brain malformation, and all that. So it became an issue. Studies and research found out that when children come down with this rash and fever in our clinic, ordinarily it looks like measles, but when we go further to investigate, we found out that, it's not really measles, it's rubella. So rubella became a problem. And so the federal government thought it was that instead of giving just measles, let's combine it with rubella so that we can tackle both viruses. So the campaign is all about vaccinating the children of the eligible age group against this virus so that we don't have outbreaks, so that they get the required immunity against this infection, so that even if they come in contact with it, because they are transmitted via the respiratory tract, so even if they come in contact, they are protected. So that's what this campaign is all about. Measles is an old vaccine.
Very old.
But we are now combining with the new one, the rubella vaccine.
Okay.
If you notice outside the country, and even in some of our private hospitals, we have MMR, which is measles, mumps, and rubella already that children have been receiving. But because of the increased incidence of rubella cases, the federal government decided to incorporate it into the national program for immunization. So routinely, we'll be giving out measles alongside with rubella going forward.
Okay, you spoke about a particular age range. So what is the age range for this vaccination?
Yes, for the measles rubella, the age range is from 9 months to 14 years during this campaign. But after the campaign, so we urge children that are above 9 months to use this opportunity to get vaccinated, because after the campaign period, only the 9 months will be eligible to get it.
Okay.
Yes.
Okay. So why can't people from the age of 15, get this vaccination?
Okay. Generally, the disease can affect any age group, but usually they are targeted age group that have and are predisposed to this disease mostly. So when we are running campaign, because there's not enough funds to vaccinate everyone, it's just like the hepatitis human papilloma virus, where we concentrated on vaccinating the 9-year-old girls. It's not that the boys are carriers. It's not that we couldn't have vaccinated the boys, but we didn't have enough money. The federal government did not have enough money to carry along the boys. Just this case. When there's vaccine, when we want to vaccinate our populace, and there's not enough funds, these vaccines are actually not completely free. Though we are giving it free to the populace, but someone is paying for it. Federal government is sourcing for funds and buying for it. So we usually concentrate on vaccinated, the targeted age group, the people that are likely to be more predisposed to these diseases. So that is why we are targeting 9 months to 14 years.
Okay. So, what's the fate of children whose parents or guardians do not allow them to access this vaccine?
Sadly, vaccine hesitancy is an issue, and that is why at the level of Primary Care Development Agency, we do a lot of sensitization and awareness before we start our campaign, because we do not want vaccine hesitancy. We do not want non-compliant. The issue is that if you as a caregiver, you refuse your child from having these vaccines, what happens is that you are predisposing them to the disease that this vaccine was supposed to tackle. So if you don't make use of this opportunity and vaccinate your child, it then means that your child is at risk of getting measles and rubella and all the consequences that come with the disease, the manifestations, the complications. Your child is at risk. And not just your child, and any other child around that was not vaccinated. And that is what we do not want for our health system. We do not want outbreak, and that's why you see at the level of primary care, one of our goals is prevention of communicable diseases. You know that our health system is not too strong. We have shortage of manpower. Our facilities, we are still struggling to renovate the bulk of our facility. So we just want to be able to handle the number of clients that come to us. We don't want a situation where we run into outbreaks and then we will be overwhelmed. So I urge every parent out there to seize this opportunity and get every eligible child vaccinated.
Absolutely. So this vaccination exercise is slated for February 4th.
Yes, our
February
flag off
15th.
is on the 3rd of February. The deputy governor will be flagging up the campaign on the 3rd of February at Primary Care Ikoransa. Subsequently, from 4th to 15th of February, we'll be going around vaccinating our children 9 months to 14 years against the measles, rubella viruses. But then, we may have 1 or 2 missed opportunity for a routine immunization for children 0 to 23 months. So my caregivers will be going alongside with other routine antigens that we usually give to those age group. So if you have a child that have missed any of the under 1 year routine vaccination, this is an opportunity to vaccinate that child. We are also going to be going about with a human papilloma virus vaccine for our young girls 9 years who may not have been vaccinated. So those 3 groups of vaccines, my health workers will be going around them. You'll find my health workers in our facility. All our facilities, we have these vaccines. They will be going to schools. Our proprietors, the educators have been informed. They were part of the stakeholders we had engagement meeting with. They'll be going to churches where our religious leaders have a role to play. We also had engagement with our religious leaders, mosques,
churches,
market square, recreational ground. Anywhere we have a targeted age group, my health workers will be there to vaccinate them.
So at the end of the day, this vaccination exercise, the health workers are coming to the
primarily
the
we
recipients.
expect,
They are not going to.
No. We expect. That's why I say we have them in our facilities. We expect the caregivers to bring the children, but not everybody. And that is why I said, apart from having it in the facility, we are going out in search of these cases, especially the non-compliant cases, to get them on board.
All right, thank you so much, Dr. Vivian Mesembo, too. We know that you're a very busy person, but before we let you go, what word of encouragement would you give to parents as this vaccine exercise is about to commence? What would you like to tell them? What would you like to inform them?
I would like to tell our parents and our caregiver out there that our vaccines are potent, 100% potent. They are free. The federal government have paid for it, so nobody should ask for you to pay for it. But I'd like you to know that measles, rubella are very contagious viruses that have complications on our children. So I urge you all to use this opportunity to vaccinate every eligible child out there. 9 to 14 years for measles rubella virus, 0 to 23 months for our routine RIs, them, LPV, hepatitis B virus, the pentavirus, the HPV, and all routine RIs that we give under 1 year old, and hepatitis human papilloma virus vaccine for our 9-year-old girls. So these vaccines are available, they are free, they are safe, and I urge all our caregivers to use this opportunity that every eligible child out there should be vaccinated in order for us to have a free and safe community, and in order for us to be able to deliver quality health care to the good people of Cross River State. Thank you.
All right, thank you so much, the Director General of the Primary Healthcare Development Agency, Dr. Vivian Masembo too. You heard it from her. Ensure that you avail yourself from 4th February to 15th February for this measles rubella vaccine. It's very important. Health, at the end of the day, is wealth. So ensure that you avail your wards, your children, to take this vaccine. It's not going to kill you. It's not going to do anything negative to you. It's just going to improve your overall health. This much can take on this segment of the show. We're going back to the music. After this is the interview with the members of the Parasitology Society of Nigeria, and they're going to talk about the neglected tropical diseases right here on UNICAL 103.5 FM. I'll leave in the hands of Ashake. This one says, Lonely at the Top. Do not move away from your radio set.